And I can say good morning from our partners, that is the Americans and the Canadians. My name is Mustafa Sizia. I'm among the organizers for this year's for the second edition of the Gam-Diaspora debate, and I'll be serving as the moderator for tonight. So before going any further, I think just like we often do it in the Gambia, we can all pray in our various ways for a minute before actually starting the thing. So yeah, thank you. Amin ya Rabbin, Alma alayhi dual bi muta. So going with our agenda, I would like to invite Mr. Sadio A.K. Jaju, the president of the Association of Government Students in India, to give the opening remarks. So Mr. Jaju, if you are with us, the floor is all yours.
Assalamu alaikum. Thank you so very much, Mr. Education Minister. Greetings. Good evening from the Indian side. Good morning for those joining from Canada and, of course, the United States of America. Those joining from Africa, I believe it's afternoon, especially those in the Gambia. Um, okay, so today we are gathered here again to witness another debate. Yesterday night we opened the first debate floor, which was the opening or the commencement session as far as this year's debate championship is concerned, the Gam-Diaspora debate championship is concerned. So today again we are about witnessing another clash between titans, of course, Canada and that of the United States. So as we are set for a thrilling discussion, thought-provoking, thoughts and everything, we will look forward to something that is going to carry us all along, because I know the motion beforehand is a burning issue in the Gambia, and most of us would want to delve into it as far as health is concerned. To the Young Champion Debaters Association of the Gambia, who are the adjudicators for this year's championship and last year, we say thank you so very much for partnering once again. I've seen various executive members from the said association joining us, and of course to the 9th Executive Council of Gambia through the Education Ministry. Thank you so very much for joining this crusade, and we thank each and every one of you that joins us from around the globe. That being said, I, Sajo A.K. Jaju, the president of the 9th Executive Council of the Association of Gambian Students in India, hereby declare today's session open. So let the fight or let the debate begins. Thank you all so very much. Allah Baraka.
Thank you very much, Mr. A.K. Jaju, for those wonderful remarks. And okay, without wasting much time, so I would like to call on the leader from the Young Champions Debater Association to actually take up the mantle now, so we can start the debate. Mr. Basiri, if you are with us. Mr. Basiru, are you with us? I think we have actually lost Mr. Basiru, so let us just give him some time for him to actually sort out the issues he's facing. Then he, okay, I think he's around again. Mr. Basiru, if you're around, then you can take over.
Sorry, I'm just trying to regulate my laptop. I wanted to ensure that even my face is visible from the other side, but it's like that machine. If you are talking, I do not understand exactly what's the problem. I do not hear you or something like that. I'm sorry for that. Just to save time, let me just maintain my default machine. Yeah. Okay. Thank you so much. Welcome to this to another interesting round that will be the other side. The neighbors today are clashing. But before we move, I just want to sit down or bring out certain things that we need to consider at some point as debaters, as speakers, and the likes. I think the score seat is very important. We accord you the same right that we accorded the other group that was here yesterday. That would be to remind you what we are looking at as judges. Before we move further, I would like to address one thing that was brought before us. That would be the comment section. Of course, we are not trying to limit your expression. Uh, we do not want to do that, and we do not want another motion to be formulated whereby judges are trying to suppress our freedom of speech and the likes. But I'm appealing to you all, especially the audience. I'm appealing to you, and if we were together, I would have knelt down and see whether that appeal could at least have effects rather. That being said, I want to advise or to encourage everyone. It uh, really, I want to advise every want to ensure that we allow the debaters to debate and let us not interact with the motion directly on the comment section. I just appeal to you all. We respect that, and when the debate ends. Time is given to the audience to come forward and share their views regarding the motion. Yeah, I think we just want to avoid anything that can influence either the debaters or the judges' reactions to the motion. I think that is very fair. You can share up or do anything that you wish to support your people. Make sure that the language is so much coded to an extent that it reflects certain things that can accord rights and dignity to our fellow debaters. As judges, we have to ensure that everybody is respected, and we want to emphasize that the audience also their presence honestly is very important here in this gathering. Without you, I think the debate would be so much boring. Yeah, you can support your debaters, but I want to encourage you to limit certain things, especially the topic. Just allow them to debate, allow us to judge at some point. When we are ready, we come together and we discuss. Yeah. Yeah. Oh, yeah. I'm trying to do that. That's why I changed my laptop. If when I switch the camera, I don't hear anything again. I don't know what's the problem. I think I would have addressed that before I start the meeting just to save time. I just want to continue with this. Next time, I will prepare for that. And thank you for anything of that nature. Okay. I will take you through the manual. Um, First and foremost, I want to acknowledge that this manual was prepared by, or that the score sheet was prepared by the uh, Vice Chancellor Debate and Public Speaking Championship committee or was committee. We are using it. It is not that they prepared everything like this. They gave us this thing. This is just a proper score sheet used worldwide when we are using the BP style in any form of VP style, especially when it has to deal with the government and the opposition bench. You have to deal with that setting. I just want to remind some people who may not be familiar with the issue at hand. First, in our score sheet, we have what we call a content, which comprises of 40% of your total score. And in the content, we have some categories that we normally look at. That would be the arguments that is presented by the speaker. We assess whether arguments are logically sound, internally consistent, and directly related to emotion. Strong arguments clearly establish claim, reasoning, and impact. Assertions without explanation or relevance are less weight Most of the time, I encourage people, especially my fellow debaters, when judges are looking at certain things, we look at them in a way that somebody can bring the argument or print it and you judge it accordingly, and you'll be able to have chance to look at it as a debater, so that if you have anything to query, you can go forward. In doing that, we ensure that we assess your argument whether they are relevant to your conclusion, or your premises are relevant to your conclusion, whether you present very strong premises to support your conclusion, and whether they are sufficient. You can of course bring certain premises support the conclusion. You have an opponent, maybe you bring 3 or 4 premises. You have to look at the sufficient of that. Yeah, your opponent can bring 2 or 3, but when we weight the argument, we have to look at exactly, okay, whose premises we are sufficient to support the conclusion. You understand? But is your premise also, are your premises supporting your conclusion? We have to assess all those things to ensure that we have a fair uh, judgment at the end of the day, and you announce the results as expected. Example, if a team argues for banning single-use plastic, I expect a clear link between plastic usage and harm. Arguments that drift away from the policy implications of the ban are considered weak arguments. So please, let's try by all means to establish that. Now, when you talk about the critical thinking aspect of your content, we look at also debaters who analyze the motion deeply, consider multiple perspectives, and explain why their arguments matter more than the opposing sides, vice versa or vis-a-vis. This includes weighting short-term versus long-term impact, or moral versus practical consequences. We assess all these things to ensure that we give you a fairer result. For example, a debater who acknowledges the economic convenience of plastic would explain why the environment harm outweighs this benefits rather demonstrate higher analytical depth. We consider all this and we take our time to do all this assessment. That's why before we announce the results, sometimes it takes a couple of minutes. Yeah. Now, when you talk about the research, yesterday I think we had teams demonstrating very, very good research work at their own end, and we expect at some point some debaters also follow trend. We assess the quality and credibility of evidence used. Strong debaters integrate statistic, real-world data, and we have seen it yesterday, World Bank, and we talk about Afrobarometers and the likes. When statistical claims are made, mentioning statistical significance, maybe test. I just want to take you to the world of statistics. Strengthen the arguments by showing results are not due to chance. I'm not taking you to test and the likes, but I would like you to give me I would like you to give me data that I believe at some point could support your conclusion. But the opponent may come at some point, try to attack, as I told you, try to attack the methodological framework and the likes, maybe whether there was what you call consistency at the time of carrying the data, or you may attack at some point. All right, the institution rather right now is being known to be something that is like a very reliable, a very unreliable institutions. All of those things we consider that from the attacking side. When a debater states that waste reduction is statistically significant, I credit this on the research and argument strength because it demonstrates methodological reliability. Yeah, we just want to give you all these tools so that you can put those things into practice, even if it's not this debate, but in common debates and the likes. Structure, that would be another element that we would look at. That would be aside from the content that I have talked about. We have structure. And the structure we have what we call clarity and coherence. We look for speeches that are easy to follow with clear signposting. During our training, I talked to you about the signposting additionally and the likes. But to begin with, and we move on. A structured speech allows adjudicators to track the line of reasoning without confusion. For example, when a speaker outlines their case at the start and clearly separate arguments, we can follow and evaluate the case more effectively. Now, understanding rules is part of the structure of your debate. We evaluate whether each team or speaker fulfills their assigned role. And during the training, I think was it Mariam? Mariam came with this segment of the score sheet, and she explained comprehensively about the team rules and the likes. If you don't understand your role, uh, you may not argue well. And this reminds me of something like something that was raised, and we wanted to address it yesterday. I just skipped the point. That would be when you contradict your teammates. So that totals to 0 at some point. Yeah, depending on the gravity of the something or knifing or contradiction. For example, Prime Minister must define the motion, while whips should summarize and weight impacts rather than introducing new arguments. In this house, we do not have whips. We only have the first half of the debate that's occupied by four persons rather, coming from different benches, opposition and the government. Example: if a prime minister fails to define key terms, the debate lacks foundation, and this negatively affects their score. Please take this as important guide towards your debate and in subsequent debates. A logical flow is also part of the structure. We reward speeches where arguments build logically upon one another. Disorganized or contradictory points reduce persuasiveness, and for instance, a case that moves from problem identifications to consequences and then to solutions shows very strong conclusions. We reward you. I'm going to give you the marks given to each of these segments in my later deliberations. Rebuttals is part of it. That is about refuting your opponent's points. It's another segment we consider very important, and engagement. Definitions and parameters that will be the scope of your debate. Prime Minister. For the Prime Minister, we assess whether definitions are clear, fair, and reasonable, and whether they allow meaningful clash. Definitions should not be unfair, restrict the opposition. For example, a fair definition clarifies the scope without excluding key opposing arguments. You have to ensure that you limit your scope. Sometimes you come up with a very broad topic, and if you believe that okay, it is so much broad, we try by all means to limit it to the scope of the arguments at hand. If not, you risk being attacked from the opposition and the likes. Listening and engagement with opposing arguments, I and my panel place strong emphasis on direct rebuttals. Debaters must engage with specific arguments raised by opposing side rather than delivering generic responses. Let me just try and formulate an example. When a speaker directly answers an opponent's claim and explains why it fails, that rebuttal is given significant weight. If I would take it from yesterday's class, I think that happened. But let me just keep quiet for the time being. Point of information is very important as far as the debate is concerned. I evaluate with this. Today I'm using I'm using that my fellow adjudicating teammate at some point has some urgency, and he needs to address that. Of course, I have Mariam beside me. Yeah. What we will do at the end of the day, we evaluate strategic offering POI and quality of responses. POI, understand that it lasts for about 15 seconds. Accepting POI shows confidence that this speech is not ChatGPT something like that. Responding effective arguments or composed and understanding as judges, a concise arguments or Concise and relevant response to a POI strengthen speakers' engagements and credibility. And please do not fear these POIs and the likes. They can strengthen your arguments, honestly. The time management is the last thing I would look at. That would be you have to adhere to the time limits. We expect the speakers to stay within the allocated time. Overrunning or being cut off negatively affects scoring as it indicates poor preparation. Because we gave you these topics, I think, a couple of hours ago. We expect very strong preparation from your end. Um, Usually, the topic is or the debate motion is released 15 minutes before, but due to complexities of the setups and other mechanisms, we have to release the motions a couple of hours before the debate starts. A speaker kind of meet analysis losses persuasive impact. Now, for the patient on the category of the time management, and I believe it's very important. Good spacing ensures all arguments are adequately explained. We penalize speeches that rush through key points, especially the main points, or spend very long period of time on minor issues that do not add weight to the arguments. For example, a well-placed speech allows each argument to be developed and weighed clearly. Finally, the summary is on the time management still now, and it's a very important segment. I have seen something like that yesterday, and sometimes you can have some problems with these debates. And our classes or our debate, when two or three good debaters meet, if you have a very slight error, honestly, the other team would deal with you severely. Yeah, it's what we realized yesterday. It was about technicalities of this, and you have to be prepared for this. We place high value on strong conclusions. Effective summaries synthesize key arguments and explain why the team wins the debate. So if you miss it, honestly, you are missing a lot. Weak or missing conclusions reduce overall impact. Yeah. And please be fair with me. I'll be recording a lot. I'll be writing a lot. Make sure that you make the summary very clear, so that if I would miss during your miss recording any point during your arguments, I can always uh, get it from there. Yeah. Okay, that's all. I will just remind you that the debate is about to start. These motions invite us to examine a question that sits at the intersection of culture, public health, and policy. Whether traditional healers at some point should be formally integrated into Gambia's public sector. This is not a debate about dismissing tradition or rejecting science or whatsoever. As judges, we will be listening for clear definitions, realistic mechanisms, and careful engagements with Gambian context. We encourage a respectful, thoughtful, and evidence-based debate, and we wish all speakers the best. If Mariam has something to take us through, Mariama, the floor is yours before I declare the motion. It's Mariam.
Hello, everyone. I'm here. Basir, how are you? I hope you're all doing good. Um, Welcome to another session of the championship. So, like Basir already mentioned, the marking scheme and everything. I will just elaborate on the speaker conduct, like I mentioned yesterday as well. Let us respect the panel, we respect our co-debaters, and we politely request for a POI. And I will be raising my hand here when your 1 minute collapses. So you pay attention to the screen so that you can know, yes, you're now going into your unprotected time. And I'll keep doing that consequently till the end of the debate session. So if the organizing team and the host for today is set, then we can start the battle.
Mariam, yeah, thank you very much. They are all around, like all the debaters are around. So about the thing of raising your hand, so I'm thinking along the way, if you can actually turn and do a clap I think it will be better because some of them they'll be focused on their debate, so they might not actually pay much attention to it. So I don't know, like if the 1 minute elapsed, if you can clap so that they can know that they are in their unprotected time, and when the time is also over as well, you can clap so that like we can at least like avoid like this one everything new. But for us, everything
Yeah.
is okay now. They are all in now. All the debaters are in now. The agitators are, so we can start. Thank you very much.
Sure.
Okay, Mustafa. Mustafa, thank you so much for that point. It's okay. We tried doing it, I think, last year, and we had a lot of deficiencies. However, we just continue with the normal setting, and if there is a possibility to review that, of course, we will do that. Thank you so much. Okay. Um, right now, we have two teams, and I have heard over the internet that they are neighbors. Today, we are going to know whether these people are definitely good neighbors to each other or not. The House is going to witness a very interesting debate tonight, and that is Canada versus the United States of America. And the motion before us tonight is that this House believes that the traditional healers should be formally integrated into the Gambia's public health sector. I have the honor to welcome the government bench or the Prime Minister and the Deputy to assume their seat opening government. We have the opposition leader and the Deputy to assume their seat. If the people here are ready and the debaters, we are ready to listen to the Prime Minister's submission. So the Prime Minister, the floor is yours. Thank you.
I just want to confirm that everyone can see me and hear me clearly. Awesome. I am set when you are.
Yes, you can go ahead.
Awesome. Honorable Speaker, members of the House, with all protocols duly and respectfully observed, I'd like to give the structure of my debate. First, I'll define the key terms of the motion. I'll set a perimeter that will guide this House through this debate. I'll give 3 points to why I support this motion. I'll give a pre-rebuttal point. I'll summarize and conclude. The motion before the House is that this House believes that traditional healers should be formally integrated to the Gambia's public health system. The key terms centering the motion include traditional healers. Traditional healers is defined by the World Health Organization as individuals using culturally based knowledge, skills, and practice to maintain health, diagnose, and treat illness holistically, predating or existing alongside modern medicine, especially in communities with limited access to biomedical care. Integration is defined by the Oxford Dictionary as the combination of one thing to another so that they become a whole. The Gambia's public health system is defined by the WHO as a three-tiered structure focused on primary health care, aiming for universal access through community health posts, health centers, referral hospital, complemented by private and NGOs. Mr. Prime Minister, for the purpose of this debate, integration is understood to go over a 5-year transitional period. Sorry. Mr. Speaker, for the purpose of this debate, integration is understood to occur over a 5-year transitional period, during which the government is offered the time and the policy space to align traditional healing and biomedical healthcare system into a single functional public health framework. I'd like to also make it clear that this House defines traditional healers as non-spiritual and non-religious practitioners. Therefore, this House shall not consider spiritual, religious, or faith-based healing practices under this motion. Moving to my points, Mr. Speaker, my first point being health equity. Health is a human right, and every Gambian deserves healthcare that is safe, accessible, and culturally acceptable. Yet, in many of our communities, modern healthcare is distant, expensive, and unfamiliar. According to the World Health Organization, 80% of the population of developing countries, of which Gambia is included, rely on traditional health methods as their primary source of care. A recent research article published in the Gambia by the ACTA Scientific Women's Health revealed the relative ratio of local healers and Western trained doctors in relation to the entire population of the Gambia. They revealed that there is at least one local healer for about 300 people compared to one medical doctor for about 10,000 people. These two examples are evidence that majority of our people have greater access to local healers than to medical doctors. It is also evident that traditional healers are often the first point of primary care or the preferred form of care by the community, by many of our communities. Therefore, integrating traditional healers into our public health system is ensuring that a safer and well-regulated healthcare system is accessible to everyone in the Gambia. My second point, Mr. Speaker, is prevention of harmful practices and abuse. Integration of traditional healers into the Gambia's public health system is essential to protect citizens from harm and uphold their fundamental human rights. Without oversight, patients are vulnerable to unsafe and fraudulent treatments. A tragic example from our own history illustrates this. Under the former president, fraudulent HIV cures were promoted, putting countless victims' lives at risk. Victims were denied their human rights and were subjected to unnecessary abuse. The victims were misled. By formally integrating traditional healers into Gambia's public health system, the government can ensure licensing, mandatory training, scientific evaluation of treatment to ensure safety and efficiency. Healers would be required to collect data and to report treatment data, creating transparency and accountability. This system, Mr. Speaker, protects patients from abuse, exploitation, and unsafe practices, which can have detrimental effect on their health and mental health. My third point being promoting trust and compliance. A 2024 recent article published by the ACTA Scientific Women's Health explains that despite many health interventions, maternal and child mortality rates remain high in the country. This is partly because of the low usage of the formal health systems that we have, which is due to poverty, distance, a lack of trust, and the social cultural barriers within our communities. Traditional healers who are nearby, affordable, and socially trusted are often the source that is more reliable and affordable and trusted by our local communities. When the formal health system ignores the reality that some of the health systems that are in place for us are unfamiliar to our communities, people delay care and disengage from biomedical services. By integrating traditional healers, we are strengthening trust, we're improving early health-seeking behaviors, and we're increasing compliance with referrals and treatment, using an accessible and low-cost entry point to improve public health outcomes. Mr. Speaker, moving to my pre-rebuttals. The government, moving to my pre-rebuttal. Sorry. The opposition bench might come up with points that traditional medicine is unsafe. Danger lies in the lack of regulation, not in integration. Traditional healers are already operating. So if we fail to regulate them, it's going to bring more harm to the country than good. Mr. Speaker, I was able to define the key terms of the House. I set a perimeter to the debate. I gave 3 points to why I support the motion. I gave my pre-rebuttals. I summarize and conclude. Thank you.
Thank you, Prime Minister, for that wonderful deliberation. If the opposition bench is ready, that would be started by whose position would be started by the opposition leader. Opposition leader, the floor is yours.
Honorable Speaker, distinguished members of this House, my name is Fatima Sidibe, and in my capacity as the opposition leader, I hereby give the structure of my debate. I'll start by reminding the House the motion at hand, what in the parameters. I will refute some points given by the Prime Minister. I'll give 3 key points backed by statistics. I'll accept 1 POI. I'll summarize what my points, and then I'll conclude. Members of the House, the motion at hand states that the traditional healers should be formally integrated into the Gambia's public health system. I rise on the opposition bench to reject this motion, not because I disrespect culture, but because I respect life. I respect safety and evidence-based practice. Our public health system is not a cultural museum. It is a life-preserving institution that must be guided by what's proven and not what's popular or what has been here for ages. Defining key terms, the Prime Minister did mention that the traditional healers are not spiritual. Indeed, they are. In the Gambia, we know that traditional healers are indigenous practitioners who use herbal, spiritual, and ancestral approaches to care. So they are spiritual healers. Formal integration means official incorporation into state system, recognition, referrals, and public sector roles, and regulation acceptance. The main point is not even about the definitions here. The real question is whether the state should institutionalize practices that are not consistently standardized, tested, and regulated. To widen the parameters of my debate, this debate is not about traditional versus modern medicine. Ladies and gentlemen, that framing is convenience. It's easy to hide behind. We are working with and intellectually speak. Go on.
So you said that well, this is not like safety and stuff. You do realize that traditional healers are already operating in the country, right?
They are operating in the country. The debate talks about the center of this debate is formal integration. We're not talking about them existing. Them existing is coexistence, but integrating them into the public health system is now formal, and that is what this debate is centered about. You are outside the perimeter. I will not move on from that.
Order in the House, please.
Widening the parameters of this debate. It's not about traditional versus modern medicine. The real question is, what standard of care should the government of the Gambia publicly endorse and fund? The public health is obliged to protect the public through quality assurance, safety monitoring, standardized training, and scope of practice, and measurable outcomes. In evidence-based practice, ladies and gentlemen, we do not scale an intervention nationally because it's familiar, nationally because they are already existent. We scale it because it is effective, it is safe and accountable. The moment you integrate a practice into the public health system, you are telling the people that this is endorsed. You are telling them that this is trustworthy. You are telling them that this is safe to be state-backed. And that is precisely where the problem lies. Ladies and gentlemen, to debunk what the Prime Minister said, I would only accept 1 POI. She did mention health equity and accessibility, and she mentioned the WHO said 80% of the people rely on local traditional healers. That same article centered around safety, centered around effectiveness, centered around regulations, and she left that out. Moving on to her second point, the Prime Minister claims that integration will protect Gambians from harm and prevent abuses like the false HIV treatment under the former government regime. However, that very example proves the opposite. That harm occurred within state endorsement, not outside of it. What failed was regulation, accountability, and scientific oversight, not integration. Integrating traditional healers into the health system that lack practitioner level regulation does not protect patients. It legitimizes risk. Moving on to my point. Evidence-based practice rests on a simple principle. Clinical decisions should be based on best available evidence, balance, and patient values and professional expertise. But the government is asking us to jump into institutional integration without first establishing consistent proof of safety, effectiveness across conditions and across practitioners. The policy document released by the WHO in 2013 at the WHO Traditional Medicine Strategy 2014 to 2023 states that priority must be given to quality assurance, safety, proper use, effectiveness, and regulation of products, practices, and practitioners before any formal integration into national health system. So my position as an opposition leader is not anti-tradition. It's pro-standard because I refuse to confuse cultural significance with clinical validation. Moving on to my second point, A formal integration requires enforceable regulations, license and defined scope, inspection, reporting adverse effects, and legal accountability. In a study conducted by Mr. Raphael Obo, published in 2023 in an Asian journal, Research in Nursing and Health, volume 6, pages 173 to 183, states that while some laws regulate herbal and homeopathic products, there is currently no specific legal framework regulating practice and alternate medicine in the Gambia. The author concludes that the absence of practitioner level regulation presents a significant public health patient safety risk, particularly in the context of proposing for a formal integration. Now, this matters because nature does not mean safety. Just because it comes out of the soil or our great-grandparents been using it means it's safe. Without monitoring it, you cannot reliably track toxicity and contamination. You cannot reliably track drug-herb interaction. You cannot reliably track overdose or inconsistent dosing, and you cannot reliably track delayed referral outcomes. If you integrate first and regulate later, ladies and gentlemen, we are gambling with people's lives. Prime Minister, do you want to gamble with people's lives? No. I'm pretty sure that's the answer. Point 3, the motion confuses collaboration with integration. That was her POI. Going back to that again. Let me be very precise. We, the opposition, are not against communities. We are not against that communities should be, we do not say that communities should be cut off from their cultural practices. People will continue to seek traditional care regardless. And that fact is acknowledged by us. But integration is not the same as respectful coexisting or community engagement. And that answered your POI. Integration means endorsement and incorporation into public delivery. Integration, if integration is ever endorsed, it must follow this sequence: research, standard, regulations, monitoring, limited pilots, and evaluation. And this is backed by the World Health Organization Medicine Strategy 2014-2023 policy document that guides countries on how to approach traditional and complementary medicine. Ladies and gentlemen, I will now briefly walk the House through the key areas that I have addressed. Honorable House, I reminded the House the motion at hand. I widened the parameters. I debunked some points made by the Prime Minister. I presented 3 points. My first point was evidence-based practice requires proof before policy. Point 2, regulations and pharmacovigilance creates harm. And point 3, the motion confused collaboration with integration, and I accepted a POI. In conclusion, I respect heritage, cultural heritage, but I refuse to let cultural comfort override clinical responsibility. Public health systems are accountable for outcomes, and that must be built on standards, safety, and evidence. So I end where I began. Knowledge may be widespread, but evidence-based decision-making governs what we institutionalize. For that reason, this motion must reject this. For that reason, this House must reject the motion. Thank you.
If you're sad, I can. Okay. Opposition leader, you have proved, you have given us every reason to why we should integrate traditional healing into our public health system. Do you know why? Because danger comes from lack of regulation. Yes, sorry. Yes.
All right. Thank you. Thank you so much, opposition leader, for that submission. Okay, Mariama, you want to say something? Mariama, can you hear me? Oh, hello. Okay.
Mariama, unmute your mic.
Oh, sorry about that. So about the clapping stuff, I don't think it's working for the participants. So I will just go ahead with raising my hand over here. Is that okay with you guys? Team Canada and USA, is that fine with you guys?
If you could interrupt, that would be best, because I don't think we'll be very focused on like the reactions.
Okay. What about Team USA? What do you prefer? What works best for you?
I'm sorry, you couldn't hear me. Yeah, you can interrupt too, so we could know. Thank you.
All right, no problem.
All right. Thank you so much, opposition leader, for that submission. Now we are set to hear from the Deputy Prime Minister, who doubled as the Iron Man in Person for Team Canada. So the Deputy Opposition Leader, the floor is yours. Thank you.
Mr. Speaker, I do not think the opposition leader was listening at all to what I was presenting, because danger does not come from integration. Danger comes from lack of regulation. When we ignore the stuff that are happening, or we just let people practice, it's like saying, okay, we know the danger that's associated with this, but instead of integrating it and bringing regulations around it, bringing safety into it, making it more safe and more accessible to you, we're going to let you kill yourself. We're going to let you do what you want and kill yourself. Is that what you want for the people of the Gambia? Are you saying that, yes, I know that this is not healthy. I know that this is not good for them. I know that this practice is not very hygienic. It's not up to standard, but I'm not gonna interfere. I'm gonna let people do what they are gonna do, rather than integrating it into the system where you can regulate it, where you can implement trainings and regulations and data collection and scientific analysis to ensure that it is in a better form for the people to use and help the betterment of the people. But no, rather you want to let people do what they want to do just for the sake of what? Just not integrating it? Okay. Every point you brought up here just showed me that you were not listening. Your first point, your second point, your third point, everything just comes back to one point. If we do not integrate this into the system and put regulations around it, whereby we'll provide trainings, we'll provide licensing. I mentioned that we will provide licensing. I mentioned that we'll be collecting data. We'll be doing scientific research and scientific analysis to ensure that this is what is good for the country. Every little point you came here was just going on and on about everything that already said, and it's not really making sense. What do you want for the people of the Gambia? You want them to continue practicing?
POI.
Accept that.
I agree. You said danger comes from not regulating. So you were telling us that we should integrate and then regulate. That is gambling with people's lives, because you're not even sure what's going to happen later.
No,
These people are not standardized. They're not tested. They're not regulated.
Please listen. What did I say? This again, proving that you were not listening at all, proving that you're not fit to sit here and represent the people. Because I said this is a transition. Integration is a transition of a period of 5 years. Within this period, there will be licensing, there will be training, there will be collection of scientific data and analysis.
I hear you. Respectfully, I hear you.
Please do not speak when I'm speaking. I did not allow POI.
Okay.
Order, please.
Again, what you're saying doesn't make sense. It shows that you are not listening at all. I told you, this is a 5-year transitional period, which in this period, there will be licensing, there will be data collection, there will be scientific analysis to ensure that this is what is good for the people of the Gambia. You're saying that we should let the people do whatever they want just so that we cannot integrate it. It's not really making sense. You're the one that is gambling with people's life. You're the one that's telling people, okay, I know the risks that are associated with this, but instead of bringing it to us, working together, finding a solution, we're just going to let you do what you're going to do to risk your own life. I'm not going to take any more POI, so please do not interrupt me again. Mr. Speaker, I'm going to move to my my second point, which is economic empowerment and job creation. The Gambia Bureau of Statistics revealed that the national employment rate has reached 8.3%, with the youth unemployment reaching 11.5%. Former legislation allows leaders to certify, train, and employ traditional healers and employing them into the public health system, providing an income for them, creating job opportunities for people that could be there as their assistants, data collectors, or even trainers in the system. My second point is preservation of indigenous knowledge and culture. Traditional healers have been practicing in Gambia for centuries, for so many decades ago, and I can say centuries almost. These are knowledge and traditions that were generation to generation accepted. Sorry?
POI.
Accepted.
Okay, so you're talking about traditional healers have been practicing for decades or even centuries, but them being here for so long, does that still justify their reliability? Does it justify their reliability?
I am not saying that justifies their reliability. I am saying they have been surviving till it's been going until now. That means they're accessible to the people, they're affordable to the people, they are the people choice. That is why they're accessible by 80% of the population.
Them being
accessibility does not equate effectiveness.
Does not
Order, please. Order, please.
There is a danger into it. That is why we want to bring them into us. We understand there is a risk associated with it. That is why we want to integrate it into our public health system, to bring regulations around it, to provide proper training, to make sure that there's proper licensing and there's transparency and accountability for the actions that are put in there. We are not saying, okay, we are going to let you guys do whatever you want. No, we are saying we are going to bring regulations, we are going to do training, we are going to make sure that this is a safe practice for the people of the Gambia. The reason why it has been surviving for centuries, it's because it's the people's choice. And you not integrating into it's not going to stop the people from using it. I'm going to move on to my points. Basically saying that I'm moving ahead with my point that protecting our indigenous and culture. Like I said in my POI again, the reason why they are surviving this long is because they are the people's choice. It's because people find familiarity with it. It's their culture. They find they are seen by these cultural healers. Their traditional rules collide with them. Therefore, they can bring cases to them whereby they cannot go to the hospital with it.
One more minute.
Okay. Mrs. Speaker, I was able to give 2 points. I debunked all the baseless points that the government leader brought up because it really doesn't make sense. It proves that she's not fit to be in this position representing the people because she's not good at listening. Everything she has said over here, I already made it clear in my presentation. I said that there will be time whereby people will be trained and they will be given proper regulations and training, ensuring that the people's lives are in better hands instead of just saying, do whatever you want and die, which she suggests.
Thank you so much, Deputy Prime Minister, for that submission. Now the House is set to hear from the final speaker from the opposing side, who would be the Deputy Opposition Leader. So the Deputy Opposition Leader, the floor is yours.
Okay. Honorable Chair, respected adjudicators, ladies and gentlemen, as the closing opposition speaker, this is the structure of my debate. To debunk the unsubstantiated claims made by the government bench, to robustly defend and strengthen the case presented by our opening opposition, to introduce and develop my own independent line of argumentation, and to present an alternative to the deeply flawed government policy. And then finally, I would summarize and conclude. Also, I would accept one POI, but preferably in the 5th minute. So first, the government bench argues that formal integration will increase access and trust. But trust without safety is dangerous. Public health systems exist to deliver effective and reliable care, not simply familiar care. If trust causes patients to delay hospital treatment for serious illnesses, then that trust becomes harmful. That trust becomes questionable. Formal integration is impossible when there is no credible licensing or verification system for traditional in the Gambia. Second, the government claims that regulation would reject, 5th minute. The government claims that regulation would reduce harm. This assumes an enforcement capacity that the Gambia does not possess. Regulation on paper is not regulation in practice. Without monitoring, licensing, and enforcement, integration becomes symbolic and increased risk rather than reducing it. then my opposition leader has clearly already shown that traditional healers in the Gambia, they operate without license, documentations, or standardized training. There is no national registry and no reliable way to distinguish qualified practitioners from individuals who simply claim spiritual authority. When the state such practitioners reject, it grants legitimacy without accountability. And this is the foundation of harm in this motion. Building on this, I will introduce my core independent argument. Resource misallocation. This is what she failed to mention. The government's public health system already faces profound challenges. There are shortages of doctors and nurses, limited access of essential medicine, and inadequate diagnostic equipment. So what sense does it make for the Gambia? The health budget is already severely constrained. A July 2023 report by the World Bank Group that is authored by already confirms this shortage. Formal integration of traditional healers would require a massive new budgetary commitment that the Gambia does not have. Training programs, certification systems, salaries, administrative oversight, and facilities. Every dollar is spent creating a parallel, unproven structure is a dollar not spent in training community health nurses. Expanding maternal care, in childhood vaccination coverage. You can go on. This is not a debate about.
Are you saying that the lives of the people of the Gambia is not worth investing into them? Are you saying that the lives of the people of the Gambia is not worth investing into them? Are you saying that you would rather let the people of the Gambia practice on? Are you saying that you would rather let the people of the Gambia practice reliable that are not safe for them?
Order, please. Order, please.
It's not a debate about culture versus science. We don't want to hear that. It is a debate about opportunity cost. Investing in an unknown directly undermines investing in what is proven to save lives. Why do you want the government to invest in something they don't even know about that is medically proven instead of putting that same budgetary commitment in something that is proven to save lives? That is my problem with you. The people most harmed by this misallocation are the same vulnerable people the government is claiming to protect. No, you are wrong. I'm going to move on to my next point now. I don't want to hear next POI until the 5th minute, please. My second point combines false legitimacy and irreversible harm that is associated with this deeply flawed government policy. Formal integration, it sends a powerful message, guys. Traditional healers and state-approved practitioners, anytime the people hear, okay, the government approves of this practice, boom, they cannot now differentiate what is medically reliable and what is just a complementary care. It brings about confusion, and that is what we're not going to do. And I'm going to give you an alternative to your flawed policy. Hold on a second. Patients cannot even distinguish what is medically safe because they just hear one message that the government approves this, and that false legitimacy encourages people to rely on healers for conditions that require medical intervention. Example, malaria, pregnancy, tuberculosis, diabetes. These are things that require medical intervention. Khadija, no POI for you, girl. Okay, I'm not talking to you right now. These are risks that cannot be corrected later. Once the harm occurs, it's irreversible. In public health, the cost of being wrong is human lives. Are you joking with human lives right now? Okay, give me your POI. Give it to me.
We're the ones that are joking with the people's lives. You guys are just bringing points that I've already gone over and over again. I said there'll be a 5-year timeline within whereby we will localize it. You also mentioned that the people of the Gambia is not worth investing into for their health care. You're saying that the people of the Gambia need
Order, please.
Off your camera. Mr. Chair, since this is a policy-based debate, I'm going to give you an alternative that can replace this flawed government policy. So first, traditional healers, they would still remain outside the public health system. No medical endorsement or licensing. We're not wasting our time doing that. and more public education on when medical intervention is needed. More public sensitization, community health workers as cultural bridges between the people and the medical practitioners. Girl, I'm not accepting any POI from now on. Please rest. And greater investment in primary healthcare, especially in the rural areas. This is my alternative policy. I'm proposing to replace this deeply flawed ideology. We have to invest more in the primary care, healthcare in the rural areas. So this approach, it respects cultural boundaries while protecting safety and maximizing limiting resources. So if you want to give me any POI, I'm gonna do you a favor and accept one before I summarize and conclude.
POI.
Yes.
So, are you saying that? What about the people that are still practicing these traditional healers? Are you saying that they are not worth investing into? Are you saying that you would rather let them risk their life? Are you saying that you would rather let them go through all the steps that you already mentioned, rather than investing and integrating
Order, please. Order, please.
Are you saying that the lives of the Gambians are not worth investing into?
Order, please.
Integrate them in the medical system. They already exist, and that is why I gave you an alternative. Since you are not fit enough to bring what is suitable for the people. Mr. Chair and ladies and gentlemen watching me, all of nena buga mew tahuta finance getagi konna buga fagaru bu yomba bi wala bugabi warutata sa wergu yaram bi nga sani ko banya dem am fajaru bu dega bi the medical way nga ne dede bu yomba biga buga wa demal nag ñu reela. Ladies and gentlemen, from that note, I'm gonna summarize. First, I came here, I rebutted the unsubstantiated claims made by the government bench. I strengthened the opposition leaders' points. I gave my own points. I accepted a whole number of POIs that don't even make sense to me right now. And then I summarized and conclude. And before that, mind you, I gave her one good. I gave her an alternative that she can use maybe next time when she's thinking about a policy to bring up. Thank you.
Thank you so much. Thank you so much for that submission, Deputy Opposition Leader. I will take this honor to congratulate all the debaters who came here before us and presented their sides of argument. It was interesting, and you can attest to this fact that, yeah, the comment section was so much. It's okay. Thank you. Let me just. All right. Thank you so much. I think that brings us to the end of the debate tonight. And I believe that this is a half house. We had 4 speakers before us. One, Ion Manning from the Canadian team. This debate has shown us that the question of integrating traditional healers into the public sector is neither simple nor symbolic, as it was mentioned by one of our debaters. Anyway, I'm picking this from there. Okay, I'm reinforcing the point. What I'm trying to look at, I just want to make sure that it is just opened to the people for general interpretation. The arguments highlight important tensions between access and safety, cultural legitimacy, and medical standards. And there are particularities and regulations, I think, mentioned by debaters. What is clear is that public health policy must be grounded in both evidence and social reality, which I think our debaters were able to touch, and I was so much impressed by their performance. We commend the debaters for engaging seriously with these complexities and contributing meaningfully to the importance of national conversation, as I mentioned yesterday. On that note, I would allow the organizers or the chair at least to continue from there while we compile the results. In a couple of minutes, we will announce the winner of tonight's debate. See you later.
Thank you very much, Mr. Basiru. Wow, boy, I don't do that. Okay, thank you very much. So moving on to the next thing on our agenda, we are going to invite contributions on the table motions from the general members. So like what we are going to do, like we are going to give each member like something like 30 seconds to 45 seconds to at least put up your own points. So we will not allow you to go beyond that. So you can just raise your hand, and from there we are going to allow you to actually contribute to the table motion at hand here. So whoever has anything to say, you can just raise your hand and we are going to give you the floor. Okay, Mr. Aziz Bojang, you can come in here.
Hello, everyone. Can you hear me?
Sure, we can hear you.
Okay. Thank you so much for allowing me to jump in. This is really very interesting, and I really enjoy all the different sides of the topic. What I feel like is that they're all talking about the same thing. When I hear those that are against the motion, their fear is that we cannot integrate traditional healers without regulation. But the speaker for the motion is saying we need to integrate them in order to be able to regulate them. So for me, they're all talking about the same thing. Maybe the approaches are different. But let's take an example of what we see, like when the world was dealing with HIV and AIDS. They did not isolate sex, but they try to integrate it in a way that they are able to regulate it by offering safe sex methods. The same thing applies with the use of cannabis. When governments realize that this is a habit that we cannot stop, they found ways to regulate the safe use of cannabis. So what I'm saying here is that without supporting either side, is that it is important to integrate traditional healers. That integration is a process in itself, and it's not only about registration or regulation, it's about raising awareness, about the dangers and the benefits. It's about the ability to document and know who is doing what. Because trust me, whether we know it or not, there were instances in our local hospitals where relatives will take their patients out of the hospital and take them to a traditional healer. Whether the healer works or not, we are not aware. But if this is integrated, we will know where they're taking them. We'll be able to provide information, but also we will be able to know what that person does and how they do it. Integration could even mean, okay, I'm sorry, let me just.
Yeah, Mr. Aziz, thank you very much. You actually put up a very great point, but like we have other people who want to also contribute. So like got you here.
Thanks.
All right, thank you very much for that. Yeah. So if Miss I don't know, Miss or Mrs. Fatu Jobate is ready, you can come in here.
Assalamu alaikum wa rahmatullah. Good morning, good afternoon from wherever you are. I want to thank the organizers of this debate and most especially the debaters from the two teams. The topic of the day is very interesting, and I congratulate the ladies, and I'm asking where are the men? All the groups encompasses women, both the Canada team and the USA team. I just want to add on to those against the motion. For the motion, we know that traditional medicine or traditional treatment has been around for decades. But let's look at the end results. I particularly am concerned with the results coming from this traditional treatment, most especially those who would go up country or to our neighboring countries. Usually they don't come alive. They go with life and come dead, sorry to say. I don't know what they do, how they do it, but integrating them into the conventional medical sector would definitely take some time and some studies to be done. So that is my contribution. Most of them would usually go alive, though very sick, and then would come as corpse. We have to look into that before integrating them. And I also support the points given by the opposition, deputy opposition leader, whereby she mentioned that it's better to strengthen the conventional medical sector first before thinking about integrating the traditional sector. Thank you very much.
Thank you very much, Mrs. Jabate, for that wonderful contribution. So, Canadian Gambian youth, there's something like that. Yeah, if you're ready, you can come in here. The floor is yours.
Can you hear me?
Sure, loud and clear.
Yes, thank you, everyone. I think, okay, so I just wanted to go straight to the point of, I wanted to comment on what Aziz Bojan said. So based on my experience, I'm not here to against or disagree on the motion, but we all know that traditional medications has helped long time during that time. And during that time when our parents were using it, our grandparents, you don't used to hear about loss of high blood pressures, cancers, other stuff, right? So every aspect that you see, whether it's medical or tradition, there's always a good practice and there's always a bad practice in both of them. Even in medical, there are still some areas where like there's a bad practice. And recently, I can attest to that. For example, endometriosis. Lots of women are going through it, but even medically right now, they don't even know how to cure it. The only one thing they were going to tell you, use birth control. If you use birth control, what will end up happening? You don't have the kids, and we wanted to bring children in this world. So in essence, what I'm trying to say is that it's always important. You don't stop, like there is a good practice in traditional medication, but it also requires an improvement, which I believe that needs to integrate it into our medical system, because before the medicines, there was a traditional healers. And during that time, they used to live longer. But now with the medical situation that is happening, name how many issues that we're having, COVID-19, other stuff. So what I believe is that it's important as a nation. I think this is something that we should all learn from each other, that we should empower and advocate for the traditional healers to be integrated into the healthcare system. In this way, it's going to help a lot. If there's certain stuff medically, they cannot cure it, but obviously the traditional healers can cure it. So I believe that so that's what I believe in, is like it's always good to integrate the traditional healers. I mean, they're still doing a good job. I'm not saying that they are not bad practice on that side, but I feel that if they invest more into it, it's going to help a lot. It's just kind of like, for example, I'm a Wolof and you're telling me that, hey, buy the laka Olaf. So if you're telling me buy the laka Olaf, then Olaf la nampa. It's kind of like you're telling me stop your identity, stop your root. So it's kind of like we're taking the Western world medication, leaving our traditional stuff that we used to do before. We all know that at that time, during that time, it's very rare you used to hear about like a maternity rate, like a cancers, high blood, and other stuff. Up to yeah, I'll come back.
Thank you very much. Thank you very much. I love these back and forth, like the way the things are going, very respectful and everything. Yeah. So, Mr. Aziz, if you still have anything to add, or if there is anyone in attendance right now who wants to add anything left, the floor is still open.
I just want to quickly jump in and add something, because I think I am a victim of this traditional healer. I have my immediate brother who is now kind of disabled. He got an accident, and instead of going to the hospital, he refused. And I was there at the time. I said to him, "You have to go to hospital." But he refused because he does not trust the conventional system. And he insisted on going to a traditional healer. I mean, 3 months along the road, nothing works. And it's now at a point where it is going to be so costly to even use the modern thing. The point I'm trying to make here is if traditional healers are integrated, that traditional healer who was attempting to do or whatever they were trying to do with my brother would have first said to them, go to the hospital, get an x-ray so that I know the extent of the damage. That's the integration that we are talking about. We have this in Ghana. Ghana now have integrated traditional healers. And at some point, doctors will tell you, go to that traditional healer. They already know them. They know what they do. They know the effect of the medicine that they use. What is lacking in our own system, especially with this modern thing, is that we are not researching even the substances that the traditional healers are using. Here in the West, including US and Canada, you see people going back to traditional healing. We've seen the Chinese acupuncture. It's not a scientific modern thing. It was a traditional practice that has been integrated into now the modern healing. So I understand regulations, but the best way to regulate someone or to regulate a practice is not to condemn it, is to work with it, understand it, and help them understand the dangers.
Thank you very much. Thank you very much for that one, Mr. Aziz. So just like you are saying, I think I have also saw a similar thing in the Gambia. I don't know whether you are going to know the guy. They call him Dabo. So he's very much focused when it comes to fractures and everything. So like right now, I think what they are doing for him, like they are actually trying to train him with regards to the reading of the X-rays, because like people are still focused on the guy. Because if players have fractures, they are like Allah Samba Daboya. So I think like what you're actually saying, they are trying to do a similar thing. Now that we cannot prevent people from going to Dabo, but we are going to actually invite him to the health sector to see how best we can work with him to actually minimize casualties or long-term complications. So thank you very much for that wonderful remark as well. So Mr. Aliu Keso, if you are ready, like the floor is yours. Mr. Aliu Keso, are you with us? Oh, it's like Aliu is gone. So Miss or Mrs. Mariama Toure, if you are with us, like the floor is yours. It's like we have lost Mariama Toure as well. So Mrs. Fatou Jobate, I can see your hand is still up. If you have anything to add, like the floor is yours.
No, sorry, I forgot to bring it down.
It's all right, it's not a big deal. So to our president, Sadio Eke Jaju, if you have anything to add, like the floor is yours.
Yes, thank you very much, Mr. Moderator. Um, honestly, I believe this is one of the most contested debates I've ever witnessed in my debating career, being it on physical ground and as well on, on online. So honestly, the debaters had put in a lot of effort. They've put in a lot of energy, and from the look of things, it's like it's more or less like both members of the IS, that is the government, as well as the opposition, really understand the assignment. To say, I would say the government bench are traditional healers, and I would say the opposition are into the conventional medicine, or let me say the health system per se. So the motion that is being tabled reads: this House believes that traditional healers should be formally integrated into Gambia's public health system. So looking at the said motion, I think it's more or less a policy motion, and I believe both sides of the aisle actually did well, because if I were to debate in this, I believe the side of the government could have given a policy, which I believe they've done. So it could have been in such a way that, okay, let's say, as far as this is concerned, you're talking about integration. So if you're integrating it, how are you going to do it? Is it gonna be a bill that will be passed by the Minister of Health to the Parliament? From Parliament, you have maybe a referendum of it, if possible. Then you get to the executive and things like that. So the motion is very, very timely, and I believe it is very, very key, because nowadays every Tom, Dick, and Harry Potter in the Gambia, or most of us would call ourselves healers or whatsoever we would call it. So I think it's very, very good that we have such motions coming on board, discussing them, weighing our ideas as far as they're concerned. On the high side also, I believe the opposition did very well as far as the motion is concerned, because if we're talking about integration, like the term is quite heavy. But again, if you're talking about the health sector, you already have a conventional type. So how do we go about it? How do we integrate it? If we are not integrating it, what are we going to do as a nation? What are we going to do as individuals? And I believe the opposition did very well on that, bringing side examples, bringing alternatives as far as the said motion is concerned. So in a nutshell, I believe the debate is well contested, and the judges or the adjudicators will be put to a very big task. I know it's not going to be easy to grade or to score these debaters. However, we look forward to subsequent rounds. But honestly speaking, this is was really a clash of titans. It was a battle of ideas. It was a clash between doyens. So I think that's the contribution from my end. And one thing I want to say is, as far as the comments are concerned, it doesn't have any influence on the decision of the adjudicators, just as the moderators would always reiterate. So it is, let us all feel free to weigh in our our ideas or our opinions as far as the motion is concerned. It has no effect on what has already been debated in the outside of the 7 minutes or the 28 minutes that the debaters had debated for. So let's come on board. Every time and again, we all will talk about traditional healers. We will talk about the public health system, this and this and that. So in one way or the other, we all have one or two things to put to the table. So let us all come on board. Let's say a word or two, and I believe it's going to add to the health sector of the Gambia. So that being said, thank you all so very much, and back to you, Mr. Moderator.
Thank you very much, Mr. Jaji, for those wonderful remarks. So, Mariama Ture, your hand is still up, right? If you still have anything to say, you can come in. The floor is yours. Definitely, Mariama down now. So, yeah. So, Mr. Aziz, you can come again if you're ready. Oh, Canadian government, you. Okay, Mr. Aziz, you can come again.
Okay, I think time I'm gonna go local language.
No problem. Very good. Very good. Yeah.
Yes. I don't know if many of you know me, but I might be a dark to some of you because I'm retired. That's how old I am. Limo Bugawa, which language do you want me to speak? Because between Mandinka and Wolof, I don't know which one I speak best.
No, at this point you can just mix and blend. Def ko mbahar rek. Mahali yung language.
Wow. The Giremak Santa debaters, especially Haley Jigeni debate from US, they're very progressive, aggressive, buganako torop, te same point dafa am solo. Te lingen wahitam important na. Su fekkee am na lu ma bugg a wax mooy ngalla bu leen des ci America boo leen jeexalee seen jàng nañ deelu dem dimbale Gambia parce que soxla nañ leen te seen idea yi soxla nañ leen waaye li ma bugg rek ñu bàyyi xel even fii garab yi ñoo wa ak li ñoo faji ci lan lañ leen dee jëlee most of them are plant based nañ leen waxante dëgg most of garabin they use the faj fee. The most effective ones are even plant-based. Then traditional healers, most of them plant-based la ñoo use. kon lan mooy différence bi fii mooy the safety aspect of it te dafa am li ma bugg a wax fii dinaa leen jox I've lived enough to see so many things man bi may juddu lopitaan amut courant amut xam nga man suma yaay bi mu wasinee dañ dem jëli xobi banaana tàngal ko mu toog ci ñu koy bos deewut man deewum what is it what has changed si jamono boobu ak léegi ba tax na ba the same suma yaay bu doon wasin tey bu demut lopitaan boo moytuwul bakkanam des ci man suma bakkan des ci that is the disconnect boo xam ne bii researchers yi jéemuñu koo seet is it something moo xew waaye am na benn nit ku ñuul ku ne booy lekki tubaab suñ la faje nit ku ñuul du baax sooy lekki nit ku ñuul buñ la dee faj ci faji tubaab du dem I don't know whether this is true or not waaye dama koy siyaa pour yéen ñi nga xam ne young health practitioners ngeen cee bàyyi xel has it got something to do with the chemical content of garab yiñ dee jël parce que fii réewi tubaab amul lenn looy lekka loo xam ne amul chemical content dinañ la ne is organic how organic is it amut so ndax foogu leen ne chemical content bi mooy problème bi ak ki nga xam ne mu ngi dëkk juddoo ci kaw gi moom li muy lekka xaat li mu am any chemical content kooku boo koy faji nit ku ñuul dafay dox obviously so dama bugga ngeen bàyyi loolu xel trop buñ condemn everything waaye itam the best way to help our traditional healers again I'm coming back to that we have to work with them we take the best practice and then you encourage them you drop the worst practices Gambia loolu lañ need Africa loolu lañ need harama emagum fii waaye di leen jaajëfal mbaali bee konton na ñing kaca diata baake a diata adu ngammen jejang ayen ñaafa ayen kontaan ali initiative menta na Gambia banko nyanta wole tala nun ñing kaca nyanta kela nun a national discourse leti not a debate online here ñing nyanta kela a debate leti meya lonko Gambian kol nyanta kasi ka kaca ala baraka baake mbali be tentula mbali jayela
Mr. Aziz Boja, or should I say our own grandpa? Thank you very much for those wonderful remarks. I think from here, we are going to create an environment whereby we can actually have such kind of discussions, because I think the development of our country and for our sectors to actually move forward, these are actually the kind of discussions that we need to entertain among ourselves, to have a very, very meaningful discussions whereby no one will feel left out and everything. Yeah. So Canadian Government Youth Development. So yeah, if you are ready, the floor is yours.
Hello, assalamu alaikum. Can you guys hear me?
Sure, we can hear you.
My name is actually, let me put my camera on. My apologies for that. My name is Tia Jallo. I'm here in Toronto. I just wanted to say I really appreciate being a listener to this great discussion that's happening here. And I want to congratulate everyone for the hard work in preparing this, especially the organizers and the debaters. Like my good brother here, Mr. Aziz said, I think he mentioned most of the things that I wanted to talk about. But I do appreciate in both sides of the discussion. I myself, I work in the healthcare sector for many years now. I've seen the shortfall of the scientific field or the medical field, and I also see it from the traditional medicine. My only concern with traditional medicine is that there is no safety checks anybody can just wake up one day and then say, hobby CEO, or this is good for you, just take it. So anything that you ingest, there's a potential risk of damage internally, but there's no studies, there's no grouping, there's no evaluation to see what kind of damage it does in your system. So I find that should be something. I mean, this is a great discourse. I think this will be happening in a broader scale. But thank you for initiating this kind of talks. That's my only concern about traditional medicine. I know it works, and I know we've had it several years before. I know our vice president there has raised some concerns here about issues with traditional, domestic scientific medicine and traditional medicine, but the difference in between those two is at least scientific. We know the risk involved. There's some regulatory standpoint where you're forced to disclose some of the risk involved, even though there are risks that are not clearly defined. And I think in the context of Gambia, people are just taking any medication without even looking at the risk. And I don't think risk is discussed at even a scientific level for both traditional and scientific medicine. So Gambia, in general, people are just given medicine by just anybody, both scientifically and traditionally. So those are some of the two key areas where I think maybe subsequent debates we can delve in. In regards to the points and the structure of the debate, my only suggestion would be, even though both sides are very passionate, there are times when they were not listening to each other, and I really wanted to see what the argument was, but I didn't get the opportunity to get what the argument was because the other side was not listening. I think subsequently we may have a more structured way where when somebody is against your ideas, allow them to say what they're saying, so we can learn from the other one, from their thought. I don't know if that makes sense, but in general, I think it is such a wonderful debate, and I appreciate the wonderful women who came forward, and I know they did a lot of research on it, and I really appreciate that. So thank you all.
Thank you very much for those wonderful remarks. So, we are still waiting on the adjudicators, and if it has actually come to our notice that one of the attendees is actually the mom of one of our debaters here. So this is more like we are telling people so this platform is open to everyone because it was very very hard to have people to actually come on board to actually participate in this debate, and most of these people they actually come out they volunteered. So we'll be having more of these debates. So yeah, I think this is going to be more of a motivation to each and everyone here. This platform is for everyone. You don't actually need to be perfect for you to actually come out here and debate. You just need to have a little bit of them from during the train and everything, then you can at least improve on it. Yeah. So Mr. VP Modu Luis, I've seen you are in cell here. The floor is yours.
Yeah, thank you. Thank you very much, Bataba. Assalamu alaikum to all the people who are present here today, to witness this wonderful battle of ideas. To be honest, this debate, it was really good. I guess even the educators were enjoying it at some point. Yeah. At the end of the day, this is what we call a debate. It's not just an argument, but it's like how you exchange ideas, how you are able to convince each other using ideas instead of just talking here and there. But at the end of the day, the topic it's a very important topic because at some point, as a Gambian, whether young or old, at some point, you have encountered these two type of medications in the Gambia, either the traditional medication or when it comes to the scientific medication. And at the end of the day, for me, the thing is, I wouldn't condemn traditional medication, to be honest, because once I had a fracture, I went to a traditional healer who healed my leg. Yeah. And I felt that, okay, it's fine. And it's not really disturbing me right now. I don't know how it's going to be in the future. But the thing is, there's assurance to when you're using scientific medications. And there are some medications which the same medication at the same time. Maybe a paracetamol can heal modulus, but a paracetamol cannot heal Batapa due to some circumstances of Batapa. Maybe Batapa is allergic to some medication. Because even as a doctor, before they give you medication, they ask you, okay, are you allergic to this and this and this? So if you have allergies to certain things, there are medications you cannot take. If though it might work for Modu, but it might not work for Batapa due to, it might heal something but cause another problem. I guess someone mentioned something about that. Yeah. So at the end of the day too, at the end of the day too, the traditional medication, there's no assurance one, there's no prescription too. You don't know. They will just tell you, okay, take one kasi ataya. At the end of the day, you don't know what that one kasi ataya contains and all of those stuff. So for me, that is the problem. If they're integrated to the system, at the end of the day, it's just going to be scientific at the end of the day because they have to test all those medications, put it to processing, make a quantity of prescription that, okay, this is what you should take and that is what you should take. Yeah, so I guess many hands are up right now, but I wouldn't want to take much time, but, I just wanted to say something because to be honest, today it was really good. So thank you very much. And thank you to all, that our dad, or I would say grandfather who was here, and our mommy who is here too, we really appreciate it. We wish that, okay, in many, many, many more debates, you guys will be present, inshallah. Yeah, thank you very much, Bartova.
Thank you very much, Mr. Lewis, for those wonderful remarks here. So, Mr. Aziz Bojang, our own grandpa. So I think along the way, we are going to give you the chance for you to give us a remark before we actually have our own official closing remark. So if you can please stay with us, we want to hear from our grandpa. So Melburi Juf, you are here with us. If you are ready, the floor is yours. You can just on your camera. Hey, yo, please on it. Thank you.
Yeah, actually, I just wanted to show you this. Can you folks see it? This is roots from the plants in Africa that they got me. I had a condition here that I was dealing with for quite some time. I mean, taking medications all the time. I think the medications were helpful, but I was concerned about the chemical content. So I requested for this. And I got this. I've been drinking it for 3 years now, and my conditions have improved significantly. Yes, there is no scientific proof. There is no dosage. And like someone pointed out, it could be that this in the long run will have some side effects. But for now, it has at least helped me, heal me from the sickness that I was struggling with. I also have some other things here. To be quite honest, lafta mem folaja wala lima fi buga wax moy man bayina drinki tubabi, bayina leki tubabi KFC, bayina a lot of things parce que dama xamne yoyu safety measures sinde jël bokana ci di jël chemicals. Man duma docteur de waye dafa am kena kuma musa wax dara mu ne ma garab yi ñoo defar benn jàngoro la ñoo jël def ko ci garab bi pour mu reyal la benn jàngoro. So like COVID vaccine bi benn jàngoro lañ defar pour mu mun la reyal jàngoro yi COVID. Bu ko reyee ba pare lan lay def moom ci yow lay des. So this is why I take this. Li ma bugg a wax mooy this is still not safe. Waaye suñ buggee mu safe léegi ñun liñ war a def mooy suñoo integrate suñ traditional healers seen traditional medicine bi ci lañ war a def research ñu def ci research ñu def lab test xam di properties yi fa ne the content su ko defee ñu mun leen a advice like someone said da ngay feebar ñu jox la garab bi ne la soo xëyee suba nga naan depending dina am koo xam ne kaas lay naan dina am koo xam ne full butel lay naan mun na am danger. So the danger is real. Dama buga debaters yi xam loolu is real, and those that are against the motion have genuine concern. Why buñ leen ko dismiss? What is lacking is a process boo xam ne bii nañ integrate in ways yoo xam ne ñun dinañ ci jàngee dara te buñ ci jàngee dara we can even have our own mun nañ cee develop suñ own conventional medicine from the traditional medicine yiñ dee use loolu laa am lu ma leen wax tey. Thank you so much for this platform. Waaye di leen gën a tee ñaan yéen ñi am xel pour organize forum bi approach leen the Gambian authorities buñ ko munta am even bu dee di ngeen am a local television bu koy mun a air in the Gambia nañ leen ko def te buñ koy def ñu try yokka ci local language parce que Gambia itam jànga bi bari. Thank you so much.
Mr. Bojan, thank you very much. Thank you so very much for those wonderful remarks. I think for Gamin, we want to have you on board. So I don't know whether you are in the America or Canada. So if you can please, if you can have your number so that we can be in contact with you in regards to our various events that we will be having, because we want to have you on board. Because in our group they are saying that we want to have our grandpa every time. So Mr. Melburi Juf, you can come in now.
Hello, good morning. Can you hear me?
Yes, we can hear you. If I can have you, maybe if you can send it to your.
Okay. Is it better now? Can you hear me?
Okay,
Young man, can you hear me?
Yeah. Melburi, you can come in. I don't know Melburi Juf. Sorry, I don't know what I'm pronouncing.
Yes. No. Oh, I'm sorry about that. My daughter will just run towards me. Thank you so much for giving me the floor. I'm very happy to be part of this debate, this discourse, this dialogue. Call it what you may. You know what we're witnessing here is a cross-generational, scientific, societal, and also it's a reality check. What we're discussing here, especially when I hear Mr. Bojang speak so passionately about the past, the historical narrative, if you look at it, for all of us to have been here today, right now, we're the products of our ancestors, our grandfathers, our great-grandparents, for the things that they did that worked well for them. So now fast forward, now a lot of us on this call, we're millennials. We are, a lot of us are educated. We know what globalization has meant. It means that there's new concepts, research and development, testing, right? There's all kinds of testing that is going on. Our great-grandparents, unfortunately, they did it in their own ways. They were always, like for me, I believe in things like karite, like doing alam, there's something that I really cherish in this part of the world. I'm in Canada. I mix it with a lot of the lotions and things that I use, right? I also eat products that I know are better for me than junk foods. These complex carbs, I believe in the cherries, the findis, all those local items that people in, let's say right now, rural Gambia, maybe that's what most people eat, right? In urban Gambia, we don't eat, we think that Western food is the best thing, right? We think that, it is the coolest thing, whereby going back to the roots has always solved our ancestors' problems. And if we keep on doing it, it will solve some of our problems, not all of it. But the fact that we have changed our diet, we have kept those diets without even knowing and our offspring. And this is why this reality check today, it makes sense to have, and we need to have more of it, because without it, we are nothing, right? We cannot throw away our values to cherish other people's values. There's a lot of things in the Western world that has changed the medical discourse of history, vaccinations and all these things. In Africa, I'm sorry to say, we didn't have a lot of these things. Where our great-grandparents faltered, the West made gains on, right? but there's also a lot of things. Whenever you look at a medication, you'll see medicinal ingredients, non-medicinal ingredients. The only difference they've done is they've had centuries of research and development. They have worked on it. They've unfortunately used animals and sometimes people as guinea pigs, even without us knowing. But the important thing is, what can we learn from them to integrate it with our medicinal, historical, medical, traditional history to make it work for us? Because those things made our DNA. It's in our DNA. And the moment we forget about them, moment boobu la ñuy lor suñu bopp te bëgguñu loolu kenn bëggut loolu kenn ñaanul loolu. So let's go back to our roots, but understand what globalization can do for us. Thank you.
Thank you very much, Mr. Melburi, for those wonderful remarks here. So, Miss Jakomba Jabi, if you are on here, the floor is yours. Yeah.
Good evening, everybody. I really love this topic, and then I'm hearing a lot of fascinating things from a lot of speakers, which is amazing. I feel like this is beyond like debate itself. It should be a collective program that everyone can come and then at least share their insights on. So normally, like every drug that is being produced in the world, they go through a systematic process called clinical trials. So in that clinical trials, they go through phases to see the risk evaluation mitigation strategies for every drug that is supposed to be introduced into the market. So in that, they look at two certain things. They call them the pharmacokinetics and the pharmacodynamics, in which they look at how the body is going to react to the medicine itself. And also they look at how the medicine is going to react in the body in terms of absorption, in terms of mitigation, excretion, and the likes. So if you look at all of this, is that in clinical trials, at the end of the day, no drug is safe, like what they mentioned before. No drug is going to be safe. So if you be like, okay, we're going through Western medication because, yeah, they're scientifically studied, they went through clinical trial processes, but still now that risk of evaluation and mitigation strategies are not 100%. So it will not be safe at the same time. If we go back to our roots, you look at before globalization, before colonization, West Africans and our ancestors were actually using herbal medications, and it was working for them. So one of the like amazing strategies that we can do is do an integration in which these traditional medicines can be scientifically studied. They can also go through the clinical trial processes so that we can know what dose is going to be effective. We look at the efficacy, and we also look at the safety margins of these traditional medicines, because they work. And some of the countries in the world are trying to achieve this. If you go to Ghana, they have systems like this, and you go to China, they're saying no to Western medication. Because like what the uncle was saying, if you look at the COVID vaccine, it's targeted to kill the COVID-19 cells in the system, but it has other risk of infections, and it has other problems that they are not being targeted, because in some clinical trial processes they do not look at like the toxicity levels of these medicines after they've been introduced into the market. Some of these scientists only look at, okay, I'm trying to find a drug that can cure malaria, or I'm trying to find a drug that can cure hypertension or something. So he's not going to look at the other issues that the drug might bring, because they will be like, okay, if the toxicity margin is very high, let's introduce the drug into the market. But they don't look at also that minimal amount of toxicity it's going to have in the human system. And that is where the problem lies, because at the end of the day, if we want to go for the majority, it's going to be a utilitarian system, rather than we should look at the common good, because you're trying to cure a whole disease. Yeah, you've cured it, boom, fine, it's wonderful, but you're not looking at other systems of mitigation or risk of infections that it's actually doing in the human system. So I feel like at the end of the day, the people that are going to say traditional medicines are not safe because they don't have dosage control. They're not being scientifically tested. If you look at it, even the ones that are going through clinical trial processes are not also targeting the solution 100%. So at the end of the day, in fact, those drugs will be highly toxic than the ones that we claim to be traditional, because these traditional medications, they're actually, yeah, they're not scientifically tested, but if you look at it, they're from the natural source. And the ones that we have in the Western systems, it's more of, how do I, it's more of a variant of that type. And some of these have gone through cloning processes. Some of the molecules have been redefined, restructured to become, hit molecules, or like to become lead molecules for medicines. And at the end of the day, pharmaceuticals are only looking at how much money they're earning. They're not looking at the human safety principles, even though they will talk about ethical principles, they will talk about the FDA processes and the likes, the drug licensing and all those things. But money matters. And sometimes they offer pharmacists a lot of money to develop certain kinds of drug, and in most situations these people do not respect the ethics of clinical trials at the end of the day. Because if you have family situations or you have personal issues and they are offering you $300,000 to $1 million or more than that, you're not going to look at, okay, what kind of damage am I doing to the population, to the human population in the world? And then you also look at people that have this depopulation principles in their mind. They are bringing medicines into into the world market that, it's targeting a particular demographic because they're trying to find ways in which they can reduce the human population. So all of this should be put into consideration. Globalization can be looked at an advantageous level, but we should not also forget the disadvantages of it. And we should not lose our roots completely because of globalization. Rather, we can integrate, we can stratify and restructure what we have based on the knowledge we've gathered so far. So it's a very wonderful debate, a wonderful topic. I feel like this should be really, really explored more. And then people need to be sensitized about these issues. And then we need to look at it from a deeper level. And thank you all.
Thank you very much, Ms. Jakomba, for those wonderful remarks here. So, Canadian Gambians youth. So, let's build the patients. Like the educators, I'm sure they will soon be with us because we are contributing on them for the results. But I'm sure because of the kind of debate we have today, so they have to take all the time required to actually accumulate everything and give us the best possible final result. So, Canadian Gambian youth, if you have anything to say, the floor is open. Mr. Aziz Bojang, Mrs. Fatu Jobate, Mr. Milburi Juf, yeah, the floor is open to everyone. Whoever has anything to add, you can just come in.
Yes, I'm just going to come back quickly. And I appreciate the comments that are all shared, especially this last comment that our sister here said, how clinical trials are run. Yes, so I do agree that even though in medicine, there are most medication that we see, including all these well-known antibiotics that everybody prescribes in the Gambia, they do have risk. And sometimes some of these medication, the risk of harm is greater than the good, that the cure that they're gonna do. In the Gambia, right now, the most, according to just rough estimate, one of the biggest issue there health-wise is diabetes and gastrointestinal issues. And for in regards to diabetes, we can say mostly that it's caused by the food that we eat, because Gambia, as everybody know, is one of the poorest. We eat one of the poorest low quality of food over there, and the medications that we are eating, it does a lot of damage in the kidneys, and that does not do well in the filtration system, and it causes a lot of harm. So gastrointestinal issues, which is antibiotics that are given to everybody without having to do the risk analysis, because every small pharmacy have an antibiotic and everything. They just, anything that happens to you, they just give it to you. and it does kill a lot of good bacteria in the gut. So a lot of people are having acid reflux and all these issues, and it's not well managed. They don't manage their diseases. So that's people reliance on Western medicine. So when it comes to traditional medicine, I actually think it's best traditional medicine, if you ask me. But my only concern is there's nobody regulating it. At least in the Western medicine in the Western world, there are places like FDA, Health Canada, those in Canada, and I think EU. They also have, I forgot the name of their body that regulates these things. The risk is there and it's known. It's studied. Sometimes not all of the risks are studied through the clinical trials. Sometimes they do actually stop, discontinue a drug development because of the risk is higher. So sometimes some of the risks they started with animals, and then they see like mice and monkeys and all these things, and then they see how they developed that drug and how they adopt it in their system. And if the risk is high, then it will not pass it will not get a go ahead from Health Canada and all these other authorities. I know other countries, they rely on FDA and the European other third world countries, like places like in Africa, they rely on the studies that are done by FDA and all this to see if they're going to approve a drug in their country or not. But I don't know. I know we have a medicine control system in the Gambia, but I'm not sure how deeply they're involved in regulating drugs. But that's another thing that we should be looking into when we are following this discussion. Like what kind of regulation is there to regulate the drug that's going on? And the other thing we talk about how traditional medicine has been working well in our institution or in our communities before. But have you seen, okay, let's look into issues like life expectancies. Previously, during our ancestral time, what was the life expectancy? I know people were saying there's no cancer. Gambia is loaded with cancer. It's just because we don't have detection. A lot of people are passing away at a very early age, but people just say, oh, maybe Bill and be more meaty, but maybe this person has been suffering from cancer. Now there's a lot of tests and medicine, and people are hearing that and knowing what's causing the issue. But most of the things that we're worried about here in the West is in the Gambia rampantly because there's no test just to confirm it. So the life expectancy in Gambia, I don't know, has it improved from the ancestral times to now? If it has, let's say during the time when there was no Western medicine, where life expectancy was this, and then now that there's Western medicine, the life expectancy is that, and even people who were like maternal devices, fetal devices during pregnancy and or even during delivery. So I don't know, was that measured during that time? It was not. It's probably measured now because if that happened, maybe social media and everything is there. So I think in general, maybe we can look into was how access of information has changed the view of medicine. But in the safer view, I think our traditional medicine, this is what we are known for, Africa. I think we should jump into like exploring ways to develop our traditional medicine and just have a safety checks because the European system, they will send medicines. Some of us who study drugs development and other areas, you see how they've developed so many drugs. They develop it by actually using third world countries. In Africa is one of the main, and some Caribbean countries, without having to disclose any information. And later on, it will come back to realize that that's what they did, including anesthesia. All those things was used on humans. So some of the medications that are in Africa, they might be trial, so we might look into all those things too. But in general, I think this is a great discussion, and I think it's a potential of us exploring it bigger. I appeal the organizers to just explore it bigger and maybe have more people in the Gambia, like Uncle here, Mr. Bojan has said, make sure that at least the message is out there because there is Gambia do need this kind of messages out. There's a lot of people suffering from diseases, and they don't know what they're suffering from. Because Gambia, everybody will only go to the hospital when they feel sick. So people may have diabetes, but they will not even know about it.
Thank you very much, Mr. Canadian. I think like your name is Aziz, something like that. So for your remarks,
My name is Tijan.
Your Tijan, yeah. I just have a little bit of contribution to actually do. So for me, the issue I have with these traditional medicines is not because like for every medication that is been prescribed, like the European medication we are calling it, every medication has a specific dosage that is being prescribed. Like for paracetamol, you can see like an individual an adult can take from 500 to 1,005 milligrams. Like there's a number that is dosage that is being prescribed. So that dosage, like they even give an interval as to how you to take it. That can be the TDS, that is 3 times daily. So I think like if because the issue I have with this traditional medication is that like there is no specific dosage that is being given to it. And like taking it like for governments, like I know the way we think. But even my grandpa, that was he telling me, but in the long run, what happened to him? You see today that he ended up having kidney issues. So like for me, that is what I'm running away from. And like coming to the topic, it's talking about traditional healers. So for traditional healers, like just like I mentioned before, like the issue of Dabo. Because Dabo has been someone whom you know that like he has been actually curing the issue of like fractures and everything. So the doctors, like some of the doctors might even be telling you, this you are having, there's no need for you to even do surgery. Just go to Dabo. He's going to help you out. So one of the things that was even proposed was like, now that we are referring people to Dabo, why not we bring in Dabo? We teach him the way he can read X-rays. Then from there, then he can actually see the fractures. So the fractures, you know, they are compound fractures and they are protruded through the skin. He can just refer them to the hospital. And those whom you know that they are the simple ones, he can actually treat them at his level. And like with that, like they were able to actually try to create control as to the way people are going to have access to like this treatment, whether they prefer going with the traditional healers or they are going to with the hospital-based settings. But when it comes to now the medication that we are taking, for me, that's where I'm having issues. Because I've worked at Gam General Hospital for 2 years. I see the way governments have been having kidney issues. I did my practical at Banjul for 3 months as well. If you go to dialysis, you see to that like within a day, you have at least 15 to 20 people whom you know that they'll be coming for dialysis. And these are, as you know, that you cannot tell me like it's all the medications that have been taken, meaning there is something that what people are not saying that is actually happening. And now, like now that we don't have the data, we can relate it to maybe the traditional medical because they are old people that are coming. Because even the young ones, you rarely see the young ones, though it happens. But like, if you are giving percentage wise, like 90 to 95% of people that are coming, like they are of old ages, whom you know that they were actually using the issue of the traditional medicine. So I think that is the thing from my side. So I've seen people who you know they have raised their hand, but the educators have just communicated to me. I think that the results is ready. So yeah, I'm sorry, like I may not be able to allow you guys in. So Mr. Basiru, if you are ready, the floor is yours. Mr. Basiru. Mr. Basiru, you can come in here. You can come in. The floor is all yours now. Or else we already.
Hello. Can you hear me?
Yeah, I'm hearing you. You can go ahead.
Okay, thank you so much. We are here. I'll allow Mariama to give her feedback before I announce or give individual feedbacks and of course present the results. I'm sorry for that. Oh, it's so confusing. Honestly, I have a very tough case tonight. Mariama, go ahead, please. Oh, Mariama? Is Mariama being heard from that end?
No. I'm not hearing Mariama, so I don't know.
Okay. Let me come. Yeah, she's coming. I think she'll be here in a couple of seconds.
Hello, everybody. We're sorry for keeping you waiting for this long. We all know the debate was very, very heated and it was so interesting and engaging, and we were all lost in it. But without any further delay, I would like to say a thank you to all the teams for the very, very educative, engaging, thoughtful debate or submission. And the overall debate actually demonstrated a strong understanding of the topic, especially the local context. So I will just give a brief general feedback from the panel side, and then I will also talk about the time management, the pacing. Then I will let Basiru come forward to give us the individual remarks, the feedback on each speaker or debater, and then tell us what is the outcome of the debate and who emerges as the winner of this debate, and also who will be given the best speaker of the debate. So like when it comes to the overall debate demonstration, the government bench successfully gave the argument that based on the Gambian reality by giving us examples and scenarios that are going on in the Gambia. She talked about, she outlined the potential benefits of legal, formally integrating traditional healers in the Gambian health care. That is cultural accessibility, early health seeking, and also regulating the existing practices that are already going on. She also talked about the fact that the community trusts these traditional healers, and then they are easily accessible and they are more affordable than the actual healthcare. So this shows that she really understood the topic at hand, and she gave us a local context of the topic at hand as well. But equally, the opposition raised valid concerns around the safety, such as the regulation, like how is it going to be regulated and how are they going to be licensed. So the opposition too came with concern regarding the regulation of the integration of the traditional healers in our healthcare. And then they gave us very, very, very good points where they mentioned that legalizing it, that is making it legitimate without accountability. Legitimacy on paper only without accountability will mean like gambling with people's lives. So the closing opposition made mention of this, and this is a concern too. And they also rebutted on the points that the government leader said that it will be legalized using scientific-based research, licensing, data collection, scientific analysis, and trainings. And where she also mentioned that it will be taking a process of 5 years. So all this showed that they really understood the topic at hand, and then they really debated on it as expected. They engaged with the motion really well. Their structure and delivery too was also really good. So like the government member, when she came forward, she gave us a structure and she followed it through. That was her first submission. The prime minister, her first submission, she followed her structure. She said she would, her structure was to define the key terms, which she did. She gave a parameter to give 3 points, to do pre-rebuttals, to summarize, and then conclude. She did that, and that was amazing. And she followed it throughout the debate. She also debated for 7 minutes. She debated for exactly 7 minutes. So kudos to you for that. And the opponent opposition too, when she came forward, she gave us a structure and then she followed it through. The structure was laid out like this, that she was going to review the points that were given. She also gave 3 points, which were healthcare should be based on clinical practices, and then it should also be based on evidence-based practices and scientific research. She also gave us how to call it. She talked about she talked about an Asian journal, which is on WHO 2013, that talked about quality health. So, and she linked it to the topic at hand by reducing the points that were given by the Deputy Prime Minister. Her time management too was very good. Her time management was good for the fact that she debated for 7 minutes, 3 seconds, which was really good. And as she promised, she also took a POI. For Team Canada, that as a Deputy Prime Minister, when she came forward, I don't really know what was the problem. Because at first, her first submission was really, really good because she followed her structure that was given. But then the second submission, I didn't hear any structure. I don't know if Basiru did, but I didn't hear her mention that she was going to give us a structure. So, but she just came forward and then started rebuting. From there, she said she was going to give us 2 points, which she did. She talked about economic empowerment, that is the integrating traditional healers in our healthcare will create job opportunities for the traditional healers in our societies, thereby boosting the economy of the country. But this point too was rebuted by Team USA, closing opposition. And they also talked about, she talked about preserving the indigenous knowledge and culture, which was rebuted as well. She gave another point. Her third point was that people are more familiar with, they trust traditional healers for the fact that they are part of the community. And finally, she debated for 6 minutes, 47 seconds, which compared to the first submission, I would say she could have done better because the first round she debated for 7 minutes and this one is 6 minutes and 47 seconds. For the closing opposition, Team USA, they came again and gave a structure. That is what I like about their debate. They always follow their structure. So Team USA, closing opposition, gave a structure that is to debunk, to strengthen the the opposition leader's points, to give her own arguments, to give an alternative, to summarize, to take a POI within the 5th minute, which was specifically mentioned, and to summarize and conclude. She debated for 7 minutes and 39 seconds, which I think she could have done better. And she was also taking a POI at the protected time, during the protected time, like the 7 minutes. So at that point, I was kind of lost. I mean, I didn't know what was really going on because she was supposed to take a PO. She took POIs though, but she said in the 5th minute. But then even after the 7 minutes collapsed, she was still taking a POI. But apart from those things, the overall debate was very good. It was engaging. The logical presentation was, and they did a deeper analysis of the debate, and arguments were very, very convincing and really good. And they came up with very strong points as well. So I would just say good luck to all the teams while we hear from Basiru what he is going to have for us before the winner and the best speaker is announced.
Okay, thank you so much, Mariama. I think now we are almost about to witness what we call a very interesting episode in this round. You have given what we call a detailed feedback, and the points are there. One can consult them at any time. Yes, the general feedback has been given. Sorry, how would I call individual feedback have been shared with you. I just want to mention a few things that I believe shifted the attention of the debate. Honestly, I was so much happy. Now let's talk about the government bench itself. Comprises of the Prime Minister and the Deputy. Their role is to set the motion. You see, the Prime Minister was the first one to speak, submitted a very strong argument. But we have a task that a Prime Minister should complete. That would be, you have to review it in future. Let me just put it in that way, meaning you would be the first one. Nobody has spoken yet. Then you have to imagine that, okay, if my opponent would come, they would say this. And the government bench definitely presented and, how would I call it, predicted what the opposition would say. And they were able to lay down their track very well. And in that track, they have a trap which was able to handle the threat coming from the other side. I would like to mention this point. Regulation was a key term that was I think, that was set. If my opponents come here, they are going to say that, okay, it's about regulation and the likes. That's why when the Prime Minister came, that was automatically set. That was delivered to the max, of course. Yeah, when you are setting a perimeter, it's important. Yeah, you set a perimeter based on things that are very feasible, and she tried to, what I would say, she set a perimeter to an extent that she's not going to leave, or the Prime Minister will not leave the debate open, so that threat can come from different angles. And the opposing side came to destroy that threat. Subsequently, I was a bit nervous because it took me 2 hours to prepare for this debate last night to look at both sides, what they are going to look at the end of the day. It took me to go through the WHO publications and the likes, what they would say about these traditional healers and the likes. But when I came, I found that, okay, this will prove for me that, okay, hey, we are going to educate you. The spiritual aspect was the battleground, whereby the Prime Minister set up, okay, we are not going to include what you call faith-based healers or something like that. The opposition was, okay, no. We are not going to include what you call the spiritual and whatsoever people, the spiritualists. The opposition came, no, we are going to include them. The only thing that I was expecting was, okay, please, you present an argument. We are going to make a policy on a particular issue. I wanted what we call a case study. Okay, where has this policy been put in place? And you look at the outcome at the end of the day. Do you understand? That's the line of argument. This is going to be a policy. We have to look at other countries because we have research on this. If you visit what you call WHO, you will see a lot of things being discussed about these traditional healers, and a lot of materials or literature is available in the internet that you can consult. That was the only unfortunate part that I was like, I was saying, oh, this would have shifted the debate's attention. But at the end of the day, yeah, I'm not going to judge them based on what I know, or I'm going to judge them basically what's been presented before us. That was a battleground. Yeah. And if you go back to the Prime Minister, to the Prime Minister and the Deputy, they set a scope of 5 years. I don't want to go back to that. Yes, when that was mentioned, they came up with a plan. Okay, within these 5 years, this is what we are going to do. That's why the rebuttal from the opposing side was very strong. However, this was clearly stated in their policy framework. The licensing that we are going to put in place, and the regulations and everything was put in place. So I was like expecting the opposing side to come and say, all right, this is not effective. auto challenge. Okay, you are going to give the license. How would you conduct the training and the likes? Okay, this country has used it, but at the end of the day, these were the problems that they encountered. You understand? This is what we call rebuttals. Yeah, I believe that the other side was like, in fact, the two sides were more descriptive at some point. They were too descriptive. You describe the problem, but when you come, you also go into analysis. You have to present certain analytical framework that would enable the judges to come at a very conclusive evidence to say, all right, this side wins because of this, that side wins because of that. So when we lack this, what we will do to determine the results, we have to look at what's been debated, the number of premises in each conclusion, in order to have a balanced approach and we desire the results. Like for instance, the Prime Minister came up with a very tangible point, and the premises were sufficient. And I think there were a lot of premises to support a particular conclusion, especially when we talk about how would I, let me just refer myself to the points, like reliance of traditional healers, according to WHO. All of these things were supportive evidence based on data, and the rebuttal from the opposition, they were citing the same article or the same institution. But I was expecting the opposition to come and destroy this data. As I mentioned earlier, you destroy the data based on evidence. Okay, who recommended or has made a statement on this, on that? We can disprove this by bringing data, because this study was carried out around 2014 or 15, something like that. You can use recent studies to back your rebuttals. This is what I was expecting. That's why this point, it was like marked as a standing point, and it would stand until it's been rejected. Yeah, with clear evidence. That was the main point that weakened the opposition from rebutting the point of the Prime Minister. And yeah, the other thing that I realized in the debate was like, okay, the use of Jammeh's case, HIV/AIDS, I was lost. I was not able to assume whether it was for the proponent side to come up with this case to justify the inclusion of this or not. I was just a bit lost. So I decided not to assume exactly what the side. Of course, I was aware at the time that this is raised by the Prime Minister and it should be in a position to support the motion. However, the way it was analyzed in this context, I was a bit lost. I decided to avoid it. Yeah, if you come also, I'm going to look at it side by side. If you come to the research, they presented very good research, yeah, to tackle their points. But I believe that, yeah, we need research for sure. Bring us certain things, but let it not be like a descriptive one. Yeah, we have cases in Rwanda, we have cases in Kenya that we can always cite, you understand, to bring them before the debate and, of course, tell us, okay, this was practiced in this and it did not work due to this, due to that. Yeah. So when the government also came up with the economic part of it, that is like Jibos, site in Jibos, or reference in Jibos, about the youth employment in the Gambia, talking about a lot of problems. So we can use it as a way of employing our own people. Yes, I believe that is a very valid point that was mentioned. Yes, that's it. Yeah, he can create employment and the like. Yeah, I was expecting, okay, if the opposition come, all right. They came, of course, with a point trying to refute. Okay, before we cater for this, resources, what do you call, miscalculations and the likes. Okay, that was fantastic. I wanted like a real world data whereby you believe that Gambia cannot afford this. What is at hand right now that we should focus on, that you think is a national concern that should be paid more attention to than integrating these people? This is what I was. This is what I was trying to look at, But at the end of the day, it wasn't mentioned. The point of resource allocation, at the time I was listening to the debate going on, I was like, who is going to mention economic and the likes? Gambia is, at least we understand the revolution in our economy, we understand certain problems in our economy, and people are trying to play a lot of dynamics around, and we see all those sort of things. But we need to conceptualize all these things in order to refute like the job creation. Yeah. Well, they said, all right, we are not going to integrate them, but we are going to produce what we call a very solid alternative in order to replace this. And this is a fantastic point. I love alternative. Hows and the whys of a debate. Your government bench comes up with the how they're going to integrate them by a certain 5 years period or whatsoever, and why are they going to integrate them. Yeah, your duty also should come, okay, all right, your method is not good. Give us. Why do you believe that the method is not good? All right. The 5 year period, you look at the, all right, the 5, is it a span that is sufficient to equip all the traditional healers? How many of them are you going to take? That would have been the question of the day. Are you going to take in batches, 100, we train them in 3 months? It's about health. They should receive what you call sufficient training or something like that to incorporate them. You bring all those things together. This is what I was expecting. Now, if you come up with those things and these people are going to tell, okay, this 5 year period, can you train 100, maybe 100 traditional healers or something like that within this span? How effective could this be? A country A did that last year, and this was the problem at hand. You understand? That's why we are not going in for this. You destroy their proposal up to the max, then you bring what we call an alternative so that your alternative can stand. I thought that, yeah, the weight of the debate would have been, okay, the alternative in order to, in fact, in my opinion, I believe that the alternative would have been so much effective if at all it was properly placed in the framework. You have to destroy their plans first with data. Do you understand? Then, but I'm not going to judge you on what I know so far, but what's been debated. Basically, that brings us to the end of my feedback. Does it? Yeah. Now let's go to the results. Okay, very interesting. There is an area of improvement that I still need to acknowledge. Yeah, people now try to ensure that they stick to the time management. Sure. It's good. And Mariam has given you feedback on this. And the debate, I think what has accorded the winning team what they call a victory in this tonight's debate is based on technicalities. Yeah, I think it's only the techniques that I think awarded them what they call a winning spot. But debate was based on, anyway, let me just keep that aside. Okay. Yeah, some of you did very well when it's come to content. Yes, very well. But the summary, I mark you down just because of summary. You lost the debate. Yes, summary. I think that's it. That's the summary. Rebuttal just a bit. You don't rebut very strong points. Twist them. That's the issue. All right. Let's start with the Prime Minister. Structure, content, find 18 out of 20. Yeah. Thinking and analysis, 5 out of 10. Research, 5 out of 10. That's it. Good. Structure, 10. Was very fine. Rebuttals, pre-rebuttals were solid. Of course, established based on reason. I have given you the facts. All right, 20 and time management, adherence to the time management, I think also and you credit. 7 minutes was just good. Then the total score amounted to 18 after my calculation. That is 88 points from the Prime Minister. All right, Deputy Opposition Leader, did so much well, so much well. I would admit that up to my last breath. The issue with the deputy opposition leader was like, okay, fine. She appealed to our emotion. Fantastic. Great work ahead. Yeah, appealing to people's emotion is very important. Looking at the problems, try to appeal to our emotions, very, very important. She fell short when looking at the what do you call the structure of the debate. Yeah, you gave us a very good structure. You followed it, but the summary, I would like to say that if you want to come up with a summary, please do not tell us what you have done. Example, by restating your structure. I would first do this, second I would do this, third I would do this. The summary would be like to ensure that the point that you have mentioned come back to us. Okay, you have mentioned this, you have mentioned that, this and this, that and that. Please give us what you call topic sentences or points. Yeah, that's it. That's where she fell short. End of the day, I was able to score her. Okay, 75. Yeah, after compiling the results. Deputy Prime Minister, wonderful speech in the opening session, dropped down due to certain issues. Clarity, lack of structure was mentioned by Mariam, 72%. Then we have the deputy opposition leader who came up with a very solid, what do you call, framework. End of the day was given 78%. After dividing results, I have the honor that I declare the opponent government as the winner of tonight's debate. Then the closing opposition with 77 points. We have difference of 3 points. I told you, you can follow up the structure or how we evaluate it. Only time management and summary of the debate. I think that what made the difference. I'm very sorry if that echoes otherwise, but that was the only issue I could say. Congratulations to Team Canada, and thank you so much for listening.
Basiru, again, you have forgotten to tell
Oh
us
my
who
God!
is the best speaker of today's debate.
Yeah. Best speaker goes to the Prime Minister of this House. It's based on numerical data. That's what we use at some point. That was it. She was scored higher, and that would be the Prime Minister. Yeah. Thank you so much. I'm sorry for skipping the best speaker. It's very important. Yeah. But the difference is just like very slight, not a very big difference, as I told you. 3 points, I think. Yeah. Yeah, next round, I think you would do absolutely an amazing job. Come next Sunday. Thank you so much. Okay, we have the Canadian side raising their hands up. I think, is that for the judges or for the organizers of this?
No, I think it was during the contribution part. Yeah, they forgot to bring it down. But I think everything is okay.
Okay. Then thank you so much, guys. And
all right, thank you very much, Mr. Basiru, for those wonderful remarks and the result and everything. So now coming to the closing remark, we would like to invite Mr. Jallo. So Mr. Tijan Jallo, if you are around, you can come and I'll give the closing remarks. Yeah, thank you very much.
Hello, Assalamualaikum. Can you hear me? Hello.
Yes, we can hear you.
Can you guys hear me?
Yes, Mr. Tijan, you can go ahead. Mr. Tijan.
Okay, I just wanted to thank the winners. I think.
Mr.
I think there's some.
Okay, go ahead. Sorry.
Yes, I just wanted to thank the winners for putting up such a great debate, and also the follow-up too. So congratulations to both teams. It is a lot of work and a lot of courage, and you guys speak very, very well. So we are appreciative of the time that you take to do this, and also even the organizers and the team that runs this. We are grateful for being part of this initiative. So I know there's a lot of work, and thank you for taking the time to organize it and mark it and come back with a very constructive feedback, well thought of, well designed. So we really appreciate that. And those who lost this time, please take note of the advice and the feedback that you get. I'm sure next time you're gonna come back even better off than what you did today. And to everyone who's here, thank you for taking the time. It's been almost 2.5 hours to dedicate to this. And I think we should broaden this discussion into the organized. I feel that you brought in this into a bigger platform where it will be open to everyone. To be able to bring this forward, especially to the Gambian people. Thank you all. My name is Sijan Jallo. I'm here as the president of the Canadian Gambian Youth Development Association. We are in Canada, Ontario. Headquarters is in Toronto, but serving all Gambians across Canada. We are excited and proud to be part of, to be invited to watch to this great debate. I appreciate that. And in regards to this topic, it's such a great topic to discuss. We appreciate the fact that your team has selected this topic and it has opened up a big discussion that is going to be productive in order for us to change the thinking method and of the regular Gambian, and also make sure that the authorities are aware that these kind of discussions are happening. I don't know if you guys make this official where you can invite next time right to the embassy and just let them know you're having this kind of discussion. They'll be more than interested to be in attendance, because I believe, like our uncle Mr. Bojang here said, it is something that we should make sure Gambians have access to, and the teams, especially those who contributed, not only the debaters, those who contributed. There's a lot of great ideas that was shared that I wish everybody else have the access to listen to it. So we thank you all. We look forward to joining again. We look forward to being part of this discussion in the future. Please do not hesitate to research to us. You can look into cgyda.ca for the website. And also to everyone who is here today, I wanted to say thank you very much. I don't know if our Vice President Dekeba want have anything to add to this, but I want to thank everyone, and I'm appreciative of you all. And I look forward to the next session.
Thank you very much. Thank you very much. So, okay, see you guys next week, Saturday and Sunday as well for the 2 remaining group debates. So, yeah, Embedo Fujang, good night. Yeah, ala barakaba.